Tánaiste, research we in Aontú have carried out in recent times found out that over 200 children have died who are known to Child Protection Services over the past 10 years. 200 children, Tánaiste. 42 children died while actually in state care, and 164 children died who were known to Child Protection Services. Now, half the children who died while in state care died either by suicide or by drug overdose. 12 children were murdered while known to Child Protection Services over the past decade. And during the same period, 62 children who were known to Child Protection Services died by suspected suicide. And God rest them all. And I can't think of anything more shocking, anything more heartbreaking or tragic than a child committing suicide or a child being murdered. But to think that 12 children were murdered and 62 children took their own lives while under the eyes of the state is absolutely incredible, Tánaiste. These were children with their full potential and their full lives in front of them. There's a massive crisis happening, Tánaiste, at the moment. Last year, 70,000 children were referred to TUSLA. That's more children than started school last year. That's, it is 4% of the population of children in this state are being referred to TUSLA every year, and this is increasing. No doubt it's due to many factors, but of course, obviously, the lockdowns over the last 20 months certainly didn't help. We had a powerful contribution last week from Deputy McGuinness regarding the Grace case, and today we'll be having a discussion with regards to mother and baby homes, and I look forward to contributing to that debate to ensure that people and institutions are held to account for the suffering and the deaths of vulnerable women and children in the care of the state in the past. And it's really important that we get justice for people in the past. But it's also critical that we have transparency and accountability today. This is happening in your time, Tánaiste. It's happening under your watch, Tánaiste. And if we act now, we can actually have an impact in these lives. We can do something about this right now in real time. I think these facts represent an enormous human tragedy. And the issue of children being murdered while known to Child Protection Service warrants, I believe, a full, proper discussion and debate from this chamber. But I want to know from you, Tánaiste, what is being done to reduce the suicide and murder rates among children in state care or known to the Child Protection Services of this country.
Thanks very much, Deputy, and just want to thank you for bringing up this really important issue of child protection. I know it's something that we're going to debate in the House later and that we're going to continue to discuss in the weeks and months ahead. And I absolutely agree that we need to do more to help every child to get the start that they're entitled to in life. And for so many children, that's so difficult because of their circumstances of their birth, because of the lack of family support. They just don't get the start in life that they deserve. And we have a responsibility to try and make sure that they do. And it's really sad and really tragic that 12 children who were under state care or known to the state were victims of murder. But they're each individual cases. They're complex cases in some cases with complicated stories behind that. And I don't think it's, I know you're not trying to do this, but I don't think it's fair to say that TUSLA or the state in some way was responsible for that happening. But we do need to do everything we can to make sure it doesn't happen. And the same applies to the very sad figure, the very sad number of people in state care who died as a consequence of suicide. And I know you'll be aware that in Ireland we've seen suicide rates fall and fall considerably in recent years. And I think that's in part because of the additional investment in mental health, the fact that we have a national suicide prevention strategy that's working well, that we have a national office for suicide prevention, and that we have been acting in these areas and acting expeditiously. But I think the points that you raise are very valid, and I know that Minister Gorman will want to talk about them some more.
First of all, to say, obviously, many people who are working in child protection services are doing the very best they can under the circumstances that they're in. But there are things that we can do to fix this, Tánaiste. First of all, there's a major correlation between economic and societal disadvantage and some of these outcomes. So we need, as a state, to lift these communities out of poverty and to strengthen those families. But there are also specifics. So, for example, there's no emergency out of our services in any part of the country outside of Dublin at the moment for child protection. And these crises don't happen in office hours, typically. There's also major difficulties with getting mental health services to children who need them. There are Irish children currently going to Britain for psychiatric services at the moment because we don't have the capacity here. There's major problems with addiction services, and I know that there's no priority for children in care when it comes to addiction services. And there isn't enough homelessness services for children who are known to child protection in this country. So, there's other issues. The government have privatised part of the foster services currently in the state, and some of those outcomes haven't been the very best whatsoever. But rather than there being an investigation into this crisis in 50 years' time, can you commit to fixing at least those issues that I have raised today, the specifics?
Thanks, Deputy. You're absolutely right in one of the fundamental points that you make, that if we can reduce poverty and if we can reduce inequality in our society, the number of these difficult issues that arise will be less. And I know you'll acknowledge that Ireland is a country in which poverty has been falling in the last couple of years, in the last 5 or 6 years, if not the last 10 years. And we're a country in which inequality has been narrowing. I know some people try to deny that, but it is a fact, and you'll know that the Central Statistics Office and the Survey on Income and Living Conditions confirms that. And I'm proud to be a member of government that has overseen a reduction in poverty and a narrowing of inequality in Ireland over the past period. And we want that to continue, and we'll keep continuing, both by pursuing economic policies that generate wealth and social policies that reduce poverty and narrow inequality. In terms of the services, I agree that we need to invest more in our services, in TUSLA, in homeless services and in others. And it's good that we have a dedicated agency in TUSLA. We didn't have one before. It was a matter that was left to the HSE, and we need to continue to invest in TUSLA as we are now and in the next couple of years as well.